Well, hello and welcome to all of our viewers from around the world. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, today we're talking about our upcoming Gold Neonatal Online Conference 2021. And I'm delighted to say that we have Dr. Stephanie Prescott, who is here with us today. And she's going to be talking about clinical care of the neonate with cardiovascular disease. And we'll be talking about that presentation in just a moment, but I did want to let you know that you can go to the website right now at goldneonatal.com to check out all the information about this upcoming conference. It begins on June 1st with a free presentation, and then you'll be able to log in and register for the full event. And of course, come and listen to Stephanie live, where you'll be able to ask questions and interact with the other delegates from around the world. Without any further ado, I would like to introduce Dr. Stephanie Prescott. And Stephanie, how are you doing today? It's so good to have you.
Thank you very much for inviting me.
Yeah, it's wonderful to have you here at Gold Neonatal. Stephanie, can you describe to me, well, first of all, you should let everybody know where you are in the world, since we are an international audience here. Let them know where you're practicing and what do things look like for you on a day-to-day basis right now?
Right now, I'm in Tampa, Florida, and I am an assistant professor at the University of South Florida doing research. I'm assistant director of the biobehavioral lab down here, and I have been doing some research on the effect of interpartum antibiotic prophylaxis that we give to mothers, and then how that affects their offspring, whether it be a mouse or a human.
Oh, wow. Yeah, I was actually, I was seeing some of that. So really the impact of the microbiome, which is getting a lot of press right now. We're talking about that. And people are really sort of gravitating to wanting to learn more. Can you tell me, when was it that your attention first got turned on to the microbiome and how, and really the impact? Because I think we've been talking about the microbiome for a long time, but the impact that it's having between mother and baby is a little bit more unique. Can you tell me how you got interested in serving the research there?
Yes. Well, I'm a neonatal nurse practitioner, and I have been since 2010. I've
Mhm.
actually was practicing in Northern Virginia, and I went back to school at the University of Virginia because I got interested in how the antibiotics that we give to mothers
Mm.
during pregnancy affect the baby's microbiome. And so while I was at the University of Virginia, I went to the Summer Genetics Institute, which the National Institute of Nursing Research offers, and at NIH in Bethesda. And I studied some genetics and the microbiome there, and then I ended up finishing my doctoral degree there, and then working as a postdoc in the National Cancer Institute, also studying this effect on the microbiome. And it does. We were really surprised at the beginning. We expected oral antibiotics to affect your microbiome, but
Mhm.
we found that even a couple of doses of antibiotics given intravenously do affect not only the mother's microbiome, but her offspring's
Ah,
microbiome. So now basically I'm trying to find out what those effects mean. And as
sure.
we all know, in the neonatal period, that's when you're born mostly sterile, if not entirely sterile, and
Right.
you're bombarded by microbes immediately. And as the baby colonizes, that is the time that if you have a disrupted microbiome at that point, it's going to stay with you more than an adult who gets disrupted maybe by antibiotics, but then
Sure.
eventually will return back to normal. So that's what we were trying to find out, is changes at that early time period, what that means
Right.
for later in life. Yeah.
Wow. So you got the research that there's a change. Now you have to look at the long-term impacts of how it might affect us, and of course, what we can do in order to protect ourselves. Assuming that some folks are going to need antibiotics at some point, but I think it's always knowing how we can, protect ourselves, right?
Exactly. And I don't want to say antibiotics aren't good because they really
No.
save a lot of people and
Yeah.
you need to have them, but we need to know how it's affecting the microbes and then how we can fix that problem when we do have to use it. So that's what we're working on.
Yeah, yeah. A lot to do with those decision making when we're giving them prophylaxis or in those scenarios as well. So yeah,
Exactly.
it's so interesting because it really does change. It has changed. And I've seen that even in the time that I've been working in the field, that I've seen the changes that we've made because of this research, that, we don't necessarily stop doing things, but the decision making on how we track things is really important. So I'm I'm excited for you, Stephanie.
It's fun. And luckily, I still get to play with the babies because I
Ah,
do still do some clinical work as a
right.
nurse practitioner. So I enjoy still being with the babies as well.
Yeah. Oh, that's great. Well, it's great that you've become a mentor in the field and an educator and a teacher and a lecturer, and I know you're very passionate about it. So, and that's what we always need to have folks like you, coming up and gravitating towards those students. It can be a tough job. I know that you're marking papers right now, so that's awesome. Yeah, that's
Luckily,
wonderful.
most of the students are really excited to be doing it, and especially nursing students. And I mean, it's the year of the nurse this year, right? And
Yes.
what a year to be the year of the nurse.
Wow. Yeah, certainly it. It certainly is. All right, let's talk a little bit about your presentation, because so again, the title of your presentation at Gold Neonatal this year is Clinical Care of the Neonate with Cardiovascular Disease. So take me through a couple of snippets of things that we're going to be learning with you and taking a closer look at while we have you at our Gold Neonatal Conference.
Well, I'm going to go through the common cardiovascular diseases that we see in neonates. My focus is really about the nursing care of these neonates before they're diagnosed, because
Mm,
that's in the neonatal intensive care and in the well newborn nursery. It's those babies that are born, we're either expecting the disease because it's been diagnosed in utero, or we're not expecting it because it wasn't diagnosed in utero. And I want to highlight the differences between
mhm.
respiratory and cardiovascular disease, so that we can recognize it, when symptoms usually appear and what they look like. And then also, what about normal babies who have normal hearts, but they're experiencing cardiovascular problems?
Mm.
How can we recognize that it is a cardiovascular problem, and what can we do to help mitigate that so that they're feeling better quickly?
Oh yes, absolutely. And again, this always strikes me as interesting again because the more we can sort of go through some of these things, the triage, I guess, so to speak, because there's early triage when we find out in utero, but when there is late onset symptoms, you're even going to get into sort of how some of these infants will sometimes not even showcase cardiovascular disease until sometimes days, weeks, how long, months. I mean, I've seen the left hypoplastic not show up for 30 days. What's the longest? It could be years, right? For some minor
Well, it
condition.
can be for the minor ones. Yeah, it can be a really long time before they're diagnosed. Sometimes children are not showing it until they become exercise intolerant, or
Right.
things like that.
Mm-hmm.
But yeah, this talk anyway is mostly focused on the early time points, and
Okay, great.
when you would notice, and when you're going to be most afraid of the more serious ones that need
Right.
attention right away. Yeah.
Yeah, immediate attention.
Mhm.
Excellent. Well, this is fantastic. Well, thank you so much. I'm really looking forward to this topic, and I appreciate all the work that you do in this area particularly. So, thank you so much for joining us here today at Gold Neonatal. It's been lovely chatting with you.
Thank you. Thank you for having me.
And just a quick reminder for all of those of you who are listening in right now, don't forget you can go to our website at goldneonatal.com. You can catch up with Dr. Stephanie Prescott and find out more about her in the abstract and, of course, her bio, and all of our other guest presenters who are going to be here as part of our conference. We'll look forward to having seen you all online and collaborating. We'll have our dedicated forums for all of our delegates as well. Thank you so much again for joining us here today, Stephanie. And of course, to all of you, our viewers. Bye bye for now, everyone.
Goodbye.